Hello, everybody. Welcome back to the Incubator Podcast at the 2024 CHNC Symposium. We have a very exciting segment, Daphna, coming up. We are joined by Suzanne Withborn, who is coming from Texas, and by Cameron Jobson, who I heard is related?
Yes, he's my son.
I think we should do parent-child, interviews all the time.
A very scary proposition for people who do not have such high-achieving children.
Right. That's right. Not everybody will be able to attend, but
we're very excited to have you on, Suzanne, because we were chatting before you came on air, and you were telling us a little bit about some of the work you're doing and how you're trying to standardize care in the NICU, and how basically you were able to collaborate with Cameron on a very cool project. So do you guys want to tell us more about this?
Yeah. So in short, a lot of NICUs have guidelines, and guidelines are pertaining to different types of patients in your NICU, and different guidelines apply at different times. So we found ourselves constantly missing guidelines or having lapses in our guidelines. So my son came up to me and asked me, hey, Mom, do you have an idea for a website? And I said, hey, can you make a website so that I can input a patient's demographics, and it could produce all of the different guidelines that the baby would meet criteria for. Exactly. And then also tell me the date that the guideline would apply to.
Interesting. What do you mean by that?
So, Cameron, you want to?
Yeah. Okay. So basically the website, you would input patient data such as gestational age, the date of birth, and their birth weight. And it would output a list of treatments that that patient would meet criteria for.
Yeah.
And these would be according to the Pediatrics Fort Worth guidelines. But if you wanted to, you could actually create an account on the website and edit the guidelines to suit your own
So
practice.
hold on, we're going to talk about that because that's even cooler because you're giving the opportunity of people to customize the website for their own needs. But basically, these would be then local guidelines, and you would be able to see which guidelines are applicable to the patient that you're rounding on. And so can you tell us, can you show us a little bit what this looks like?
Sure. And if you go to NICUrounds.com, you'll be able to
play around with it.
Exactly. So again, you put in the patient demographics, you hit generate treatment plan, and it will list for you all of the different guidelines that your patient meets criteria for, and it will give you the date to do that, that particular treatment.
So you guys can't see this, but this is at least a one-page single-spaced of all the things that this baby would qualify. We put in a 24-weeker we put in, but the ROP exams, when are the vaccines which frequently get missed.
Head ultrasounds.
Head ultrasounds, that's right. Even changing some of those nutritional needs, fortification,
right. And so
CMV screening.
Yeah, that's what I want to clarify, because I think that people may be misguided in thinking that, okay, you put the gestational age and it will give you hey, this baby is eligible for the ROP screening guideline.
Right.
But it's a little bit more detailed, right, Cameron? You were able to do something a little bit more detailed than that, where you're actually pulling the intervention from the guideline to say, this baby needs a head ultrasound tomorrow.
That's right.
That's
Exactly.
really cool. And it does that for everything, meaning you're supposed to fortify feeds according to our feeding protocol at this point. You are supposed to maybe try to get off invasive ventilation or something.
That's right.
And so it gives you all these interventions that you should basically aim for. And it's kind of neat. And I'm just curious, first of all, before we get into how you're using this, Cameron, this sounds like something my daughter would definitely not want to do.
So tell us some of the techie stuff.
So how did you get excited about this project?
Well, like my mom said, just one day I went up to her and asked, hey, do you want an app?
You were bored?
Yeah.
You just wanted to build a website?
I was bored. I need some experience for my resume,
Okay.
So yeah, we collaborated, and after a lot of explaining, I finally understood the sort of algorithms that a neonatologist would use to create treatment plans for their babies. And so basically, I wanted to automate this process. That way, we're not missing things on babies with low gestational age or low birth weight who typically meet criteria for a whole bunch of guidelines.
That's very interesting. And so, can you tell us a little bit about how you're using this on rounds, and how has this made your practice different/better?
Well, we've had a lot of very positive feedback because not only physicians are using this, the nurse educators, the nurses at the bedside, the case managers, multidisciplinary members are using this so that they're making sure that we're following all the things that we need them to. And the way our practice is actually using it is there's a copy-paste function at the very top. So if you're admitting a patient, you can go into this website, create your list of guidelines that patient meets criteria for, click on the copy text icon, and that will print it into your progress note or your admit note. We actually use this and print it off in an area that's not printed. And so every time I'm rounding on a patient, all I'm doing is I'm looking at the top of the list and making sure that when that date comes, I'm following the directions or the guideline that it's prompting me to remember.
That's so interesting. And is that something you're showing parents, or is that something that right now is only reserved for the clinical team?
Pretty much reserved for the clinical team.
Fair enough. And so earlier in this conversation, you guys mentioned that there is an opportunity for people to customize this website. Can you tell us a little bit about what does that require? Does it cost money, or do we have to buy subscriptions?
No, currently I provide this service for free on our website. Anyone can go and create an account for their hospital. And once you create your accounts, you'll be given a shareable link. So all of your staff members can go to that link and see the algorithm you customize for your website.
I see. And then you would be entering your own guidelines?
Yes.
Yep. We're using our guidelines as a default. So you can go in and erase whatever it is that doesn't apply.
So that it can actually know where to pull the information
Exactly.
from. That makes a lot of sense. This is so cool. Suzanne, one last question for you. What has this meant for you to be able to work on a meaningful project with your son?
It's incredible. We actually talked about looking at our babies before we implemented this project, and afterwards, and we actually found in patients that are less than 30 weeks gestation, we were able to reduce our guideline lapses by 69%.
Wow.
So I think for both of us, it's kind of exciting because we're making such an impact on our own practice, and we just can't wait to share it with everybody.
Yeah, and Cameron, be careful, because if people start finding out you're able to do this on the fly, you're going to get booked for so many other projects at the CHNC this year. Congratulations both on an amazing project collaboration. This is so cool, and we will put the link to the website in the episode page, NICUrounds.com.
That's
Suzanne, Cameron, congratulations. Thank you for dropping by.
Thanks,
of course.
guys. Good luck.